Welcome back to our video series where our live panel of therapists answer the questions you've always wanted to ask a therapist. Again, we have with us Courtney, Heather, Tammy, Lauren, and myself, I'm Stephanie. If you're watching for the first time, be sure to check out our previous videos. Today, we are discussing a few multi-part questions. So our first question for today, will I leave with a diagnosis? What if I don't like my diagnosis?
I always tell people not to get hung up on the diagnosis. I describe diagnosis simply as a word that professionals use so that instead of when I'm talking to someone, I can say, Bob has anxiety, and that person knows roughly what I mean by that. That's all it is a word to describe a set of symptoms. For billing and insurance purposes, we have to create a diagnosis and provide a diagnosis for that. However, I really emphasize to people not to get hung up on it. It's just a word that I'm using to describe a set of symptoms, to communicate that to insurance companies and other providers. It doesn't mean anything.
Yeah, I would say normally diagnosis isn't, at least for me, isn't really discussed unless I think it's relevant to your therapy services. If there's something that requires education on or a certain treatment that's really good for what's going on, I think then it's important to bring that into the session and be like, I think this is going on for you. This is what I know about it. Do you think that fits? Or it can look like all sorts of different conversations, but I don't think it comes up as often as maybe people think diagnosis does.
I would agree on all of those parts. That the majority of the time, if it's like the common cold of mental health stuff that's bringing people into treatment, it's just something that I put in for billing purposes, and it's nothing I think too much about in terms of understanding the person in front of me. It just doesn't even tell a story about who they are. However, there are times where it's incredibly useful to educate them, and sometimes it's therapeutic to know there's a name for what they've been experiencing for so long, and that they realize that there's other people who share the same symptoms and the same diagnosis, and it can be comforting.
I agree with what was said as well. I think it can be a lot of times the label isn't really a constructive part of therapy. I find many clients, I don't even think we go through that portion of it. And then sometimes it's something more general, like there is a adjustment disorder, which we would label for billing reasons, right? But they're going through a significant loss in their life, or divorce. It's a life transition. So there's just some of those different pieces. Sorry. Family came home. I was like, dang it, my dog's coming.
I do have people that ask for a diagnosis, and I will literally tell them, we need this for billing, and it doesn't change anything. Or I feel like a lot of times I'll get moms that want to know if their kid falls on the spectrum. That's a huge one where they will ask for that, is it this? Is it this? And I will always go back to not that it doesn't, not to minimize their experience, but we're treating what's going on with the kid. We can call it whatever we want. We're treating the symptoms, not the name. And so even if a kid doesn't fall on the spectrum, but they struggle with social skills, we're going to work on social skills. And maybe there's a kid on the spectrum that's not his biggest concern. And so it's just a word. It can be powerful and helpful. And then at other times it's not, it's the opposite. And actually what Courtney had mentioned earlier, I will intentionally not create anxiety in people, will withhold diagnosis for the exposure components. People with OCD, I have someone that I saw that really, really wanted to know, am I OCD? Am I OCD? Yes, he was OCD, but I was I don't know, maybe you are, maybe you're not. And so it can be kind of a therapeutic tool depending on the treatment.
I think I would ask why is it so important to have that diagnosis? I think that there might be more to that as well. There might be like you said, it might be to answer some of those questions, or so I might try to explore what like their purpose is in wanting that diagnosis, and then if they didn't like it, I think I would again explore like why are you thinking that doesn't fit? Because I think it would be valuable to hear why they feel that isn't appropriate onto them.
I think that's a good point, Tammy. I think you're right. Like it can definitely be used in a therapeutic manner to kind of learn where their thoughts are with a certain diagnosis, why it's important to know that. And the label can be a hindrance for people in ways of just continuously thinking about that and dwelling on that in different ways as well. So yeah, just reiterating that it's about the symptoms that you're presenting with, so much more, because even within, you know, a diagnosis, clearly there's so many more manifestations of people's symptoms and character traits and all that stuff going on. So it's kind of a smaller part of what we look at actually as therapists.
Yeah, depending on the sometimes the age of the client, people can overly identify with the diagnosis and sort of fuse with it so much and say, I am this. Well, no, you are who you are and you have this. It's just a kind of a component of who you are. It's not all of who you are.
When is it appropriate to reach out to your therapist? Is there an ethics or a professionalism behind it? This is multi-part, or is it different for different clinics?
I'll just start by saying that part of informed consent, during that first session, we actually have a document that we use in our practice that goes over lots of things about the norms around therapy. And part of that is contacting your therapist and in what ways is it appropriate and when it might not be appropriate. And so we kind of agreed that we won't look each other up on social media. You're not going to friend me. I'm not going to friend you. You know, with technology, there's ease of communication these days where I can use my phone, which I do for work, and I text for scheduling with clients a lot. It just makes it easy and fast. And but there are times where they'll start sending me messages that are more clinical in nature or things that they're struggling with. And then when I see them, I encourage them, can we just talk about that in session? It's very hard to talk over text. Things get missed. And so just setting some boundaries around that. With that being said, like contacting outside of session if there's an emergency or if there's a crisis, yes, I want to know. However, I am not on call 24/7. So if you're texting me at 2 a.m. tonight, I'm going to be in bed and asleep. So coming up with safety plans with those people where if I don't respond or I can't respond, what's the next step? What are you going to do?
And to go off of that, Courtney, I think that was good that you bring in informed consent. So if you are in therapy and you're wondering, you know, how and when do I contact my therapist, definitely go back to the paperwork you signed. There should be some information in there of, you know, what the parameters are. Personally, I use texting a lot for scheduling purposes. And if there's something going on and we need to meet sooner or further out, I'm usually texting my clients about those things.
I pretty much communicate that with most of my clients during that first session, is that they are always welcome to text me if there's a scheduling issue. But if there's anything clinical in nature that, I mean, obviously there's always that caveat, like if it's urgent, call 911, go to the ER. But that if there's something that they really need to discuss, you know, they need to let me know that they want to come in sooner. And like Courtney said, like that might be possible, that might not be possible. And having a dialogue around that, I think, is really important.
Again, thanks for watching. Be sure to check in next week. If you liked the video, be sure to like and subscribe to our channel, and we will see you guys next week.
Bye.